My name's Winnie, Muyindike, and I'll be sharing a little about the feasibility and acceptability of the novel Fujilam Assay to detect TB. All right. As Dr. Helena has said, this is a point-of-care test done in urine, whose results come out in about an hour. It has high performance, although more complex than the usual allerelan. So we sought to assess the feasibility of implementing the Fujilam and the acceptability by the health workers, as well as assessing the patient's perceptions on urine sampling for TB diagnosis. It was a mixed method study, feasibility study. Our population was the Fujilam test users, who were health workers, the program managers and TB policy advisors, and the patients. We used the test users' proficiency evaluation, questionnaires for the test users, and individual interviews, as well as group discussions for the program managers and the TB policy advisors. It was done in 4 outpatient sites in the 4 countries as mentioned earlier. So we shall just dive in a little about the feasibility and acceptability, because when we get a new test, sometimes we are excited, but we also want to know whether it will be feasible and acceptable for use. The Fujilam test was performed by the lab technicians. We had some nurses and clinicians and community health workers. We tried it out with several cadres in the existing outpatient clinics, and training was done before these cadres did the tests. The training took about 2 to 4 hours with practical sessions, and the additional equipment was provided by the Fujilam study, that is the urine collection bottles and the timing devices. Regarding the test users' proficiency evaluation, you can see that we assessed the practical performance of the Fujilam test, the confidence in performing the test, the theoretical knowledge about Fujilam, and the interpretation of results by the different cadre. And that line, which could be maybe brown or orange, assesses the minimum expected score. And on the overall, the test user's proficiency evaluation was good for all the 4 parts, apart from part D, where we found 1 health worker whose interpretation of Fujilam results was below the minimum expected score. The perceived ease of use, we assessed the understanding of the test cartridge parts, the performance of the test, and the interpretation of the results. And as you can see from the dark green and the light green, that the majority of test users perceived it to be very easy and easy to use, with a few who were neutral, and 1 who found it very difficult. No test or no new aspect comes without challenges. They expressed that the steps were very many, too many timed steps. Sometimes the lines to assess positivity were faint. The difficulty is ensuring the incubation period was exactly 40 minutes. Sometimes they got invalid results, especially when the urine was turbid or blood-stained. And the test cartridge buttons sometimes were stiff, or the users pressed the order the other way around. So there were some challenges which can be overcome with training. The test users' perception on integration of Fujilam into the daily activities. We did assess 2 types of users: the users who regularly performed the Fujilam test and the users who occasionally came in to perform the Fujilam test. Those who regularly performed the Fujilam test, 4 out of 7 felt that it was very easy and could be integrated into the daily activities. While the users who occasionally performed the test, 4 out of 11, that's a kind of a fairly big percentage, felt it was very difficult. And we shall get a few of the quotes. Difficult to integrate into the daily activities. On the overall, the turnaround time is about 1 hour and a few minutes for all the sites. It was similar. Okay. So some of the quotes we got and definitive themes we made out of it. Despite the challenges to integrate the tests into the daily activities, 4 out of the 6 interviewed felt that they could continue with other activities during the 40 minutes incubation. One nurse mentioned, given the time for the test to be completed, it becomes difficult to integrate into the daily work. It may be easier for somebody working in the lab to do this. As you all know, in our program care services, we have other work which runs along, clinical consultations, administrative, health education, and other tests. In regard to where should the Fujilam test be performed, should we use the consultation rooms? Should we use the lab? Or where? One lab manager mentioned that the Fujilam is quite complex compared to other rapid tests. For this, he felt that this test needs to be performed in the laboratory because it has more steps. One nurse felt if you are receiving 20 patients in a day, not all necessarily need Fujilam, 1 or 2 or 3 may. So she felt it could go into the consultation room. In regard to who should perform the Fujilam test, one lab technician felt if there is good training, really anyone can do it. Another lab technician felt that it may be easy for some people to understand the steps, but there are really some people who may find it so difficult even after training. I'm just shortening. And one coordinator felt that if you have health workers who are well motivated and knowledgeable and trained, they could do the test as long as they feel the workload they have is not too much. Some of the policymakers, one policymaker mentioned, he really saw it as a game changer, which may be able to work in remote places where sputum microscopy or other tests have not worked well. However, we have to consider the issue of funding, and one program manager felt it's difficult for a country like Uganda, or maybe difficult for any country, to have 2 tests doing similar work, and then you procure them, and how do you handle all that issue? The idea to replace Alerilam with Fujilam becomes difficult because the country already has Alerilam. In terms of our recommendations, we felt that the Fujilam may be implemented in outpatient settings. It can be performed technically by any health worker as long as there is adequate training. The issue of who performs it, we felt that the selection, there should be some task shifting. However, places into consideration the workload. And there is need for short Fujilam turnaround time test results. The challenges faced, as mentioned earlier, can be dealt with, some of them through proper training, some of them if the kit and the buttons as made by the companies which make it, it can be improved. In terms of patients' perspectives as to whether the urine sampling for TB diagnosis works for them, one quote said, "I cannot have any concerns on urine sample collection because the urine is mine and it's from my body. I can go and remove it, and there is nothing I can say about it because it is in my body. I can submit it when needed." While another quote said, "I would rather collect urine sample because, as said, you may not be coughing or producing sputum. May not be easy and you have to induce it, whereas urine production is easy." Okay? So we felt that in terms of urine, it is easy and quick to produce, and some felt that it was preferred to sputum sampling, simpler, painless, cleaner, less stigmatizing. In terms of added perceptions from the patients, how much trust did they have in urine sampling, urine-based TB testing? The trust the patients had in urine-based TB testing depended on their understanding of the TB etiology and the previous experience with urine-based TB. One quote said, "I do not see a connection between TB and urine. For me, I've always known TB is in the lungs. I would believe sputum results more." Another, "I trust TB results from urine because urine is all around, is all the water that comes from the different parts of the body, while sputum only stays in the lungs, in the chest." So you could see that the trust depended on their understanding of the TB disease. Another quote, "They may have tried testing in sputum, but it wasn't diagnosed. Sometimes it is tested in blood and it is not diagnosed. So I feel urine is another thing that may help." So we felt the urine sampling, should it be an additional test or can it be an alternative TB testing method, an additional test to others? The other concern was about, do you receive results the same day? And some patients were willing to wait. Most patients are willing to wait because they've come for treatment, as long as they can get the treatment, get the diagnosis and get treatment on the same day. And we did make the diagnosis and manage to refer patients for treatment. In terms of urine sampling facilitators, the sampling instructions were very important, as given by. The sampling instructions were very important. The toilet cleanliness, privacy, and proximity, as well as the stigma-reducing strategies. I'll just give one quote there because I'm told my time is up, but as you know, qualitative is a lot detailed. "I would like to find the toilet with running water, toilet paper, and soap. The place should be also clean so that I do not acquire another infection." So, and many other quotes, but patients felt it's an easy test, but they need to be comfortable, they won't pick up another infection. What else motivated? What else would be the motivating factors? The rapport with the health workers, and the concerns about One Health, especially if you're symptomatic. If you're symptomatic, whatever the health worker tells you to produce for your diagnosis works well. So our conclusions, the Fujilam test was feasible to implement. It required short training, and it could work well within the existing infrastructure and resources. The proficiency assessments showed competency across all types of users. It was perceived as easy to use, although there was mixed views on integration, given the daily workload. The urine sample provision for TB testing was well accepted by patients, especially if knowledgeable about TB etiology, and on the overall, Fujilam can be implemented. at point of care in our patients, and it's well accepted by test users and patients. Thank you very much.